with that, I will turn it over to Mike Curry.
Thank you, Governor Baker, to Lieutenant Governor Polito, and who has become my good friend, Secretary Sutters. We talk at 7-something in the morning. And our friends at Blue Cross and Blue Shield, represented here today by Andrew Dreyfus, and Manny Lopes, the President and CEO of the East Boston Neighborhood Health Center. We all know that COVID-19 hasn't affected everyone equally. The hardest hit places in Massachusetts are places where our Black, brown, immigrant, and low-income residents live. There is no doubt in anyone's mind that these communities continue to bear the physical, emotional, and financial brunt of this pandemic. And at the state's 52 community health centers, we see that suffering up close every day. In the earliest days of the pandemic, health centers figured out how to stand up COVID-19 testing and telehealth, and threw themselves into contact tracing to begin to find a way out of this nightmare for their patients. At the same time, we continue to meet our patients' healthcare needs, like we always do. That means providing high-quality care while also acknowledging the realities of our patients' lives, speaking their languages, and understanding their cultural beliefs and systems, including their justifiable mistrust in our medical and government institutions. But importantly, our patients trust us. And it is that trust, joined with our experience and expertise, that makes us uniquely qualified to get these vaccines to the people who need it most. And we're just getting started. Just like those in the early days of testing, community health centers are building up their capacity to deliver these life-saving vaccines. Health centers have been vaccinating their staff since December, and most are now starting to vaccinate patients who are 75 years and older, and also administering the vaccine in congregate care settings like housing shelters when they can, and partnering with community organizations like boards of health, hospital partners, and others to plan for how we can most efficiently and effectively bring real access to the patients who most urgently need the vaccine. I want to quickly acknowledge our friends at Mass General Brigham for providing 600 doses of the vaccine in Roxbury, Cape Cod, and Lowell when they were running short on vaccines. Some, like East Boston Neighborhood Health Center, as well as Lynn Community Health Center, Greater Lawrence Family Health Center, and Manic Community Health Center in Quincy, are stepping out with local partners on larger scale vaccine clinics. And with the right infrastructure investments, health centers and our community partners know we can do even more. Like funding for the Massachusetts Department of Public Health, which is helping us launch a multilingual vaccine engagement campaign for our hardest to reach patients and those who remain most vaccine hesitant. The funding helps health centers in several critical ways, all of which are founded on conversation. First, it supports providers and staff in having respectful one-on-one talks with patients to answer their questions and concerns that truly move the needle on vaccine hesitancy. Second, through work with community health workers and community partners, it brings these intimate dialogues to the broader community, increasing the number of people who may want to get the vaccine. And third, through online and other channels, it directly encourages patients with culturally and linguistically appropriate messaging and discussing the COVID-19 vaccine with family and friends. Throughout the efforts, we apply two principles that we believe are foundational for health equity: treating patients as respected allies and celebrating their cultures and communities. And as we speak, health centers across the state are ramping up their operations. That means hiring temporary staff, building out new call management systems, securing or repurposing mobile units, leasing community space to accommodate more patients, partnering with other community-based organizations who are key to helping us address hesitancy and to disseminating accurate and consistent information and messaging about the vaccine. This will be a major effort, the biggest of any of us can ever recall in public health. But with the combination of continued strong support and investment from federal, state, and local governments, as well as our strong philanthropic community, health centers will get it done, like we always do. We are supportive and appreciative of our partners in the philanthropic community who have been reaching out and asking how they can support us in this moment. Now I'm speaking to the 52 community health centers that serve more than 1 million patients. That's 1 in 7 in the Commonwealth. This is all a testament to your commitment and your tireless frontline heroes at the health centers for whom no challenge is too daunting. To the health center staff across the Commonwealth, including those here at East Boston, we say thank you. I also want to say that we know that there are people out there, particularly in communities of color, who still aren't sure about taking the COVID-19 vaccine, and we get that. Your local community health center understands that you have a lot of questions and concerns, and they want to hear what's on your mind. Our staff also want to share what we know about the vaccine and what your doctors and nurses are recommending for even their own patients and families. And there are so many other doctors and nurses of color out there who want to help by understanding the legitimate concerns, reservations of patients, and providing testimonials and taking the vaccine. I just want to lift up one in my closing remarks. Melissa Houston called me recently and she said, Michael, I work for a local hospital, but I want to give up my free time to come volunteer at health centers. And she followed up 2 days later with about 15 other nurses that she said are ready and willing and able to come in and support the work of community health centers. So I want to say to the governor, the lieutenant governor, the secretary, and our partners at Blue Cross and Blue Shield, and our friends and family here at East Boston Health Center, we're ready to go. In the advocacy community, we have a saying, we say, fired up, ready to go. And we're fired up and ready to go. Thank you.
Try following that.
You're about to.
Right. I want to thank Michael Manny for hosting us, the governor, lieutenant governor, and Secretary Sutters. Governor, we appreciate the vital work that you and your team have done to mobilize against what is the greatest public health challenge of our lifetime. At Blue Cross Blue Shield, we've been proud to partner with the Baker administration on a number of initiatives. Blue Cross has deployed our associates from our call center to work alongside the Department of Public Health as contact tracers and our clinicians to the Boston Hope and other field hospitals. We have waived cost shares for telehealth visits and for COVID testing, treatment, and now vaccines to ensure access to care. We, in cooperation with Secretary Sutters, have bolstered mental health care and support for our members, especially for children. And with our foundation, we've provided more than $11 million in support to organizations across the state and provided nearly 140,000 meals from our company kitchens. As we all know, as the governor said, the goal is to get everyone in Massachusetts vaccinated as soon as we can. That's why the administration, the Commonwealth, and the health centers have made extraordinary efforts to set vaccination sites up across the state. But we have to make sure people can get there. We know that one barrier, especially in the underserved communities that Michael just talked about, has been transportation. And today we want to remove that barrier. So I'm pleased to announce that Blue Cross will contribute $1 million to support the work of the Mass League, East Boston, and the community health centers across the state, ensuring that all patients have safe and free transportation options for getting to and from vaccination sites. We will not be safe as a community until everyone is safe, and that means getting everyone vaccinated as soon as we can. Thank you.
Thank you, Andrew, and thank you, Governor Baker, Lieutenant Governor Polito, Secretary Sutters, and my good friend, Michael Curry. And thank you to the state for providing the resources, the staffing. We just visited one of our sites, which is being staffed by the National Guard, which was donated by the state of Massachusetts. And we know that here in East Boston, we are one of the hardest hit communities in the state. My name is Manny Lopes. I'm the president and CEO of East Boston Neighborhood Health Center. We are one of the largest community health centers in the country, serving over 120,000 patients and providing over 100,000 vaccines each and every year. Over 50 years ago, East Boston Neighborhood Health Center was founded after a group of mothers concerned about the lack of high-quality, affordable, easily accessible healthcare in our community. Our mission today is still committed, or our mission today is still founded on this commitment. We are guided by a board of directors who are patients of the health center. This local approach has been central to our COVID-19 response. For me and our staff, this is personal. I grew up in this community. My family lives in this community. And 50% of our staff lives in this community. This is not only our job, but this is our calling. That's why creating these vaccine centers in partnership with the state, these sites are being staffed by employees that resemble our patients, provide culturally competent care, multilingual support, and these sites are built by the community for the community. This work is not new to us. Since the beginning of this pandemic, as you heard, we've set up multiple testing sites, and we've processed over 115,000 tests. Thank you again, Governor Baker, Secretary Sutters, Lieutenant Governor, for all of your support and for recognizing and appreciating that we are well positioned to do this work. We're ready, and as our friend Coach Bill Belichick always says, we're ready to get this job done, and we're ready to do this today. So thank you again.